So guys, again, my name is Valeria Soltanic. Dr. Valeria Soltanic. Even my patients call me by my first name because that's the bond I have. And as I was saying, I'm going to recommend you today two amazing products that, with my 21 years of experience of being a dentist, we have some some special guests here because I have a cat here that really wants to get in the camera. So no, you don't want any toothpaste that has fluoride. Forget about fluoride. For many years, I was taught that everything has to have fluoride, your toothpaste. But now there's studies, and you've heard this, that they want to remove the fluoride from the water in the US. And yes, because it gives problems to your thyroid. Yes, and it does give problems to your brain, because with time it can have a predisposition for dementia and for Alzheimer's. So let's be proactive. Let's start working on our health for every day. So let's avoid fluoride on our toothpaste. And for this, I'm going to show you SK Balance is fluoride free, and it's limited ingredient, meaning it only has the necessary ingredients, but ingredients that you cannot find in any other toothpaste, and that is nanohydroxyapatite, because it is an ingredient, it's mineral that's going to help mineralize your teeth. That means protect them, make them strong. Because when you remove fluoride from a toothpaste, you want to have something that makes them strong. Because that's what happens with my patients that are using a fluoride-free toothpaste that has no mineralization. And I see that all the time. So many cavities are happening because of the misinformation. So this SK Balance, you can get it here on the TikTok shop. Amazing toothpaste. Has aloe vera and vitamin E. You cannot find that on any other toothpaste. You listen, guys, premium. You want something premium for your teeth, because I'm sure you buy nice creams, you protect your lips, you protect your hair. Are you forgetting your teeth? You want white, perfect teeth. As a dentist, I tell you, this is the only toothpaste that's going to do the job. And yes, as a dentist, I tell you, it's going to prevent you from visiting too often the dentist. Yes, I'm going to lose so many patients that use this toothpaste because only they're going to come for cleanings. They're not going to come for cavities. They're not going to have for gum inflammation, because the aloe vera and the vitamin E are going to soothe your gums, protect your gums. Gums are important because healthy gums don't bleed. Remember that, guys. If you have bleeding in your gums, that's not healthy. That means that something is happening and you want to switch to SK Balance toothpaste. So do you have any questions about let me take this microphone because it wasn't working. So do you have any questions? You can share, you can get it here, you can get it other places as well, but the special is on. SK Balance. What other things can I tell you about this amazing toothpaste? That this toothpaste is not made of plastic, the tube. It's plant derived, so it's gonna be good for your health. Because do you know that a regular toothpaste tube that has the plastic, that micromolecules of plastic are going to insert into that toothpaste that you're gonna brush your teeth with, and you're going to swallow it, and it's going to absorb into your system. So do you want that? So that's why I'm recommending you SK Balance. Is the first one and only toothpaste that the tube is made from sugar cane, from the plant, so it's plant derived. It's not going to give you those microplastics into your bloodstream. Yes, those same microplastics from those pans that we use, from the water bottles. No, this is free of that. Free, limited ingredient. It has only what's needed in a toothpaste to help your teeth, to whiten your teeth, to fight the sensitivity in your teeth, and it is dentist created. So what else is I'm sure other dentists don't want this, because we're not going to have so many patients to work on. Yes, it's going to prevent cavities. It's going to make your gums firm without any bleeding. So super highly recommend SK Balance toothpaste. Now let's move to another great product, Dr. Sacamancha's teeth whitening strips. So these are whitening strips designed first for people with sensitivity, those people that could never do a whitening treatment. And then because when you start, like, if you want to do a whitening treatment to someone in the clinic, for example, as a dentist, you can't, because those people are not going to tolerate the treatment. You know how many times they say, oh no, I'm gonna do it, and then you put the gel, the light, and they're like, nah, stop, take it out. And then, they lose the chance, and then they leave with the yellow teeth and they can't do anything. But yes, they can, and super affordable. You don't even have to pay those dental office prices. And these are Dr. Sacamancha's teeth whitening strips, because these are the only ones and made by dentists, real dentists, not just any dentist. And these are, you can use them if you have sensitive teeth or stains, or from coffee, wine, from tea. Tea is worse than even coffee. And they are going to not only whiten your teeth, but they are also going to make your teeth strong, because they have a similar mineral as the SK Balance toothpaste, and that is hydroxyapatite. This has nanohydroxyapatite, which is even stronger, and this that has hydroxyapatite. So you have a background. This toothpaste is so powerful that it has the nanohydroxyapatite, which was created by NASA. Yes, NASA, because it had to have a mineral that will protect the teeth of the astronauts. So to protect the teeth of the astronauts going to space, that's what they were using. And that's what is inside this toothpaste. So you'll be using the same thing to make your teeth strong and to protect them. So SK Balance toothpaste, number 1. Also, it's going to it has whitening effects. And Dr. Sacamancha's teeth whitening strips. So these are going to whiten. Each one you're going to use, so there are going to be many applications, 14 times that you can do. Necessarily, you don't need to go through all of them to have the white teeth, to whiten your teeth. So you're going to have the 14 envelopes inside. And then, let's see. And you can get that here on TikTok Shop. So let's open one. And these are not going to give any residue, so when you use them, you can literally use them anywhere, anytime, because when you take them out, they're not going to leave any gel behind. They're not going to leave anything sticking out. And so you can safely use them, like while you're getting ready, while you're, like if you do makeup, while you're doing your makeup, while you take a shower. I mean, it's obviously as long as you don't get water inside, but as when you're even where I've done them while I'm working out, anytime you can do them, because it takes 30 minutes for you to use them. So they're gonna come 2 strips. So the one that's more rectangular, this one is for the upper teeth, okay? And this one here is for the bottom teeth, for the lower arch. And as you can see, let me see there, you can see better. You have this smaller area and this bigger area. So for the lower one, this bigger area is the one that goes against the front of the teeth. And the other one here, so I am cat sitting today, so this is the star of the video. And the other one here, hello. And I think he wants the whitening, right? So the other part is the one that wraps around the back of the teeth, and the same for the top. So they're super comfortable. They stay in place, not like others that they just walk around and they're uncomfortable, and they're not going to leave you any sensitivity, because these are made for, oh my god, you're chewing my hair. These are made for people that have sensitive teeth. So let me know if you have any questions, and I'm here to answer them, because I want you to have healthy teeth. I don't want your body needs to be healthy. That's why I'm recommending you SK Balance toothpaste without any fluoride, but has something to protect the teeth, because when you remove fluoride from a toothpaste, you need to add mineralization agent, and that is nanohydroxyapatite. That's the best, most premium mineral for a toothpaste, that it's not going to damage your teeth. And the whitening, as for whitening, the toothpaste is going to help you with whitening, sensitivity, gums. And for the whitening, I recommend you Dr. Sakamancha's teeth whitening strips. Both are premium products, and they are designed by dentists, obviously, and they are feared by other dentists, because these are going to do so many wonders in your mouth, in your teeth, that, oh my god, you're never going to go back to any other toothpaste or any other ways to whiten your teeth. So remember, oh, Samantha wants, oh my god, you can get it. I don't know if you right now, TikTok Shop is only available, oh my god, he's such a star. It's only available in the US. So if you're watching from other parts of the world, I think Samantha in Dubai is in Dubai. I love Dubai. Then you can send me a message and I will let you know how to get them. And I don't know, here I'm kind of new to the live videos, so here it says invite to join live as a guest. I don't know if you guys want to join live. Let's see how this works. I'm always curious to try. Oh, you're welcome, Samantha. I love everybody that's in the whole world. Like I always get all these like people sending me message from all around, so it's always amazing. And Henry. Where is Henry from? Okay. They're so nice. Yanni, hi Yanni. Whoever is in the US, especially, well, I don't know, today here in, I'm right now in Miami, and it has been raining so much. So I'm kind of camped inside here. Now it's kind of sunny, so that's why I decided to do this video here by the window, because I want to enjoy this beautiful view now with the sun and all that. It was so bad before. And so yeah, guys, I recommend you SK Balance, super premium, the most premium toothpaste. And you want, sometimes you think it's like, why you know, you use the best products and for everything in your body, for your hair, for your skin, for you eat, you know, the best foods, but then you never thought that regular toothpaste is damaging your teeth and your body. You know, when you say, oh, I do not swallow toothpaste. Yes, you do, because absorption starts as soon as you put something in your mouth. So you have to be super careful with what kind of toothpaste you're using. So that's why I'm here. I'm taking my time on my free day to recommend you SK Balance toothpaste. Remember, it's fluoride free. It has aloe vera, vitamin E, and also has potassium nitrate, which is used in even prescription toothpaste for the sensitivity. So here you have two amazing agents. You know, as a doctor, and I remember I have a minor in chemistry too, so this is the time that those so much studying came to use. So the nanohydroxyapatite not only is going to prevent the cavities by protecting your teeth, it's also going to avoid that sensitivity, because you have sensitive teeth because the tubules, microscopic that they are in your enamel, they are exposed. So with the nanohydroxyapatite combination and the potassium nitrate, you have such a shield on your teeth that, forget it. You shouldn't like chew ice, but you're going to have ice, and you're not going to have that sensitivity. Especially, for example, you know, I used to have sensitive teeth before this, and even if you're on a very cold climate, sensitivity plays a role. Yes, so even in wintry places, this is going to help your teeth avoid that sensitivity. So try it. You're going to love it. Once you try it, you're not going to go back to any other toothpaste. And let me know if you have any questions. And for whitening, so this is going to help with your whitening, yes. And if you want to do whitening, the actual whitening of teeth, this is super affordable. Someone is chewing my hair. This is super affordable, and it's also for people that have sensitive teeth. So, and it's also created by my brother, Dr. Fernando, and me. We created this. So I'll tell you a little story. Even in clinic, when someone wants whitening, we have the apparatus, the machine, and we have everything to do. Oh, thank you, Samantha. You're gonna love it. So when someone tells me I want to do the whitening, I'm like, okay, you can do it, but then for under $20, you can get just a pack of Dr. Sacamanchas, and you will even get better results than if you, yes, I do, and I say that to my patients, because I don't need to, I'm the kind of dentist that I just want the best for my patients, and I want them to have an affordable treatment and to have it easy. Because when you do, and whatever I'm telling you right now, I tell to my patients, even though yes, I have a huge clinic together with my brother, and I see a lot of patients. Yes, it is also a business, but as a clinician, I prefer it's my heart to keep the best for the patient. Okay, so I always, number one, I recommend the most affordable. It's less than one X-ray, guys. The Dr. Sacamanchas, and I offer it in the clinic as well, but yes, you can have it here in TikTok Shop and other places. And it's better because it doesn't give you sensitivity. So first, I recommend this. Secondly, I ask my patients, are you sensitive? When they tell me they have sensitive teeth, it's out of the picture that I'm going to do a clinical whitening, because no matter how it's advertised, it will give sensitivity. As a patient, I even added stuff to the gel that we use for the whitening and everything. It will give you sensitivity. Okay, that's the honest truth. If it doesn't give you the sensitivity while you're doing the treatment, guaranteed a few hours later, the next day, it will give you that. The sensation, because I felt it, is like a ray of light running through your teeth, usually like this area here, and it is horrible. I had patients like even cry because they were sensitive. Sometimes they didn't even mention it because they just wanted the white teeth like everybody else wants. So sensitive patient, 100% Sacamanchas, you're gonna get Dr. Sacamanchas for less than $20. Like, where else are you gonna get professional whitening created by two dentists? Okay, that's why we added every possible healthy thing. They have no hydrogen peroxide, so you're not gonna have a problem. They're not gonna give you sensitivity. They're super healthy, so you can get them here and you will love them. Okay, they're available on TikTok Shop. They're available in the UAE. They're available in Europe, in the US, Canada. So you're gonna love them. Make sure you get them. Let me know how it goes, and if you have any questions, all the instructions are here the one I have is in Spanish and English. And you're gonna get also, let me see if I have it here. You're gonna get a shade guide inside. So you check where you are on this. Can you imagine if you go from here to here, like what a difference it will make? Like, imagine having this kind of yellow teeth. It ages you. Like, yellow teeth are not fun. Like, okay, nowadays, like, a lot of people use filters to change colors and this and that. But, when you're with someone, you cannot do that. I mean, at least not yet. So let's say you meet someone, or you're giving a speech, or you want to have the most beautiful white smile, because also it's a sign of health. When you have extremely dark teeth, and I see a lot of patients that are heavy smokers, or they drink a lot of coffee. Oh, okay, I was gonna say something else. When you do a clinical whitening, like in office, okay, when a patient comes to my clinic, they do a whitening there. They sign a paper first of all these There are certain medications that if they do take those medications, they cannot do the whitening. For example, medication that is for acne, that, you know, that's very strong, certain antibiotics. Why? Because of the light that is used. Also, that you should be careful with those lights that you buy, you know, out there. So there are a lot of contraindications. So let's say you're not doing any of that. You know that after a clinical whitening for 48 hours, they sign a paper and they also take the instructions with them. They cannot drink coffee, wine, tea, any foods that have red coloring, like let's say berries, like blueberries, raspberries, tomato sauce, ketchup, soy sauce. What else? Any green stuff, like let's say you drink every morning a green juice and stuff like that. Why? Because the clinical whitenings they open the pores of the teeth. Yes, we have like tubules, pores on the teeth, and it dries so much the teeth. That's why that sensitivity, that any colored food that you're going to consume after is going to absorb into the teeth. So barbecue sauce. So imagine, let's say you did a 45-minute clinical whitening, and then you leave and you have a green juice or wine, red wine. Forget it, your teeth are gonna be the shade of whatever you are drinking or eating. So for 48 hours, you're not going to be able to have any of that. How about that? Now, if you use Dr. Sacamancha's teeth whitening strips, you're not gonna have that problem. 30 minutes, you apply them while you do whatever you wanna do, wherever you are, before a party, and then you're not gonna have those issues. And these are dry in the sense that they don't have like a gel that, you know, when you take them out, it's going to give you it's gonna leave you that gooey, like like a jello thing in your teeth. So no. So let's say if it takes me 30 minutes to drive from here to go to a party, I can have them on while I'm driving. You know, when I get there, click, click, and my teeth are gonna be whiter than when I left my house. So guys, I highly recommend you Dr. Sacamancha's teeth whitening strips for your healthy teeth, healthy gums. I'm gonna recommend you Escape Balance toothpaste. So it comes in a tube, like in a box like this, and then your tube will always keep its shape. It's made from plants, so it's sustainable for the environment. And it's also, well, thank you. My English is great. Where are you from? Vision. And I guess you can tell that English is not my original language, but it's been for my whole life. So, Vision, what's your language? And if it's, I mean, I can speak Spanish, Portuguese, I can speak some French, and my next goal is to learn Arabic, so starting very soon. I'm very excited about that, talking about languages. And I speak Catalan, so I love languages. I guess it's always been kind of easy, and always curious. Oh, I've learned during the pandemic while we were inside and all that, and even after a little bit, I was learning Turkish too, so I know a little bit, and I stopped. Unfortunately, I should go back. Finnish. I'm not Finnish, no. Wow. No. I mean, I'll tell you, I am, my family is exactly half Russian, half Polish. And so I guess that, but I'm not Finnish. Nobody ever told me if I am Finnish. So where are you from? Where? Oh, I didn't get to read World Vision. You're from England? Vision? Oh, but I don't speak Russian. Oh, you're from Michigan. I can read Russian, but I don't really speak it. It's a shame. Maybe I should work on that. But I am very, very soon starting my Arabic classes. Whoever speaks Arabic pretty soon, I'm confident that I'll be able to maybe say a few words and start. I know it's one of the hardest languages, but yeah. But you know, I always like a challenge. I guess if I went through dental school, if I went through like so many, I studied biology with chemistry. So I think when you do those things that, you know, when you start as like Chinese, I think I could tackle anything when you want, you know. But I think it's important because it's I'm not gonna say I'm gonna be able to read it, but at least to speak. Because when I am in an Arabic country, I really would like to know and understand people, and also I like the culture, and I like I don't know, I like to always blend with everybody, and but yeah, I'm gonna do it. So maybe one day, I don't know if I will be able to do a live like this, but I'm sure I can at least a few words. So obviously I can do a live in Spanish, Portuguese, even French, but I don't think let's see how long it takes me to do it, and then for sure I'm gonna do it for you guys. And so yeah, so I guess, I don't know if someone has a question. I know there are not so many people watching right now, but I don't mind. Even one person for me means the world. And I will continue doing my videos. I'm a person that I'm gonna try to do them the way I really are, because I always like to laugh and, you know, have a good time while I work. So maybe we're gonna start doing videos like that. And yeah, so remember guys, if you want to try SK Balance, if you're in the US, you can get them here on TikTok Shop, other ways too, but right now we're on TikTok Live and you can get them. You can keep your teeth white, keep your gums healthy. It's so important to maintain your mouth healthy, because your mouth is connected to the whole body. Like, we're all interconnected. And yes, you can have when you have gum disease, when you have an infection, when you have a problem in your mouth, it's going to affect your whole body. So that's why we are part creators in this toothpaste, SK Balance, together with my brother, also a dentist. And it's good for your whole body, not just your teeth, and also good for the environment. Let's not forget the environment. And so this is going to be sustainable because there's no plastics. And someone's chewing my hair. And so he wants to be so much in the video. I am taking care of this beautiful cat today. He loves my hair. And if you have okay, if you need some implants, well, I actually dedicate, let's say, 90% of my time in clinic doing implants. And I would say right now, I don't like to say I'm the best in doing them, but I love doing them. And if you are in Florida, then let me know, because then I can do your implants. And it's expensive in America. Well, I don't know compared to what. I can tell you that, for example, be careful. Okay, let's talk a little. Yes, remember Escape Balance, the best toothpaste for your teeth. Also, if you have implants, crowns, restorations, you also want the nano hydroxyapatite, the vitamin E, and the aloe vera for maintaining those implants. Because it doesn't mean that if you get an implant, the implant is wow, that's it. No, you can get peri-implantitis, which is the same as periodontitis, but for the implants. Because around the implant, you have the bone and the gums. So you don't want to get a problem with your implants, because you can lose and reject the implant. So going back to implants, make sure that wherever you go to get your implants, it's a reputable implant, because a lot of clinics around the world, even in the US, they use these cheap, weird implants, God knows from where. And you want to make sure an implant comes from a company that is, controlled, the quality. Implant is not just the screw you get at a store, okay? The implant is made of titanium. Some are in the last few years. There are some implants made of ceramic, yes, but most of them are made of titanium. And not only just a piece of titanium, there are treatments to the implant, and there are micropores made to it, all made by laser, by treatment, sterilization. Because when you put the implant into the bone, you need your body to integrate, which is called osseointegration. You want the bone is going to start growing, depositing itself, your own bone cell, your own body is going to create cells like grabbing to the implant. So that's why there is a period of osseointegration of the implant into the bone. And it's very important that implant is a good implant, a good material. Also, the clinician that is doing the job, also to know where to put the implant, how to put it, and everything. So it's a mixture of factors that are going to create success. And let's see, my dentist said my sinus cavity is too low. Do you do transplants? When your sinus is too low, that usually happens because you lost already that tooth a long time ago. So the sinus is the areas here in your skull that are empty spaces. So obviously we cannot, if you have this area empty, you cannot just put an implant because you need bone. So in order to put yes, you can put an implant, but you have to do a process first, which is sinus augmentation with a bone graft. So in this case, it's not the same bone graft that we usually do when we do an extraction, that we add the powder bone to it. We have to do a sinus augmentation. That means elevate the floor of the sinus. And usually depends how much bone you have available. We can do a little graft, or we have to grab a little tiny block of bone from another area, usually from inside, and from inside the mandible or the palate. and we put it and we pin it there. You have to wait like 6 months in order to use that spot. So it is a very, very lengthy process. It is possible, 100%. It's a little more traumatic, and that's why I'm the kind of dentist that I rather vote for the prevention and taking care of your teeth. That's why we have any powder in there. That's why we created the SK Balance toothpaste, to prevent the loss of teeth. Okay, my dentist never put any powder in there. He was not good. Okay, I don't know how your process was, but oh my God, why does he like to chew my hair? Okay, the thing is, if you have a tooth that needs to be extracted, then and you're looking to put an implant, you're planning to put, your treatment plan is an implant, then you have to do a bone graft on site. And that's the same time that you do the extraction. That's how we do it, most people, that's how it's done. Because it's very hard to do a graft after, you no longer have the tooth and that. So let's say, I'm gonna explain you with SK Balance toothpaste. Let's pretend this is your tooth, and this is the socket where the tooth is. And the tooth is bad, you need an extraction. Boom, you took it out. Same time. After you take it out, we filled the space where that tooth was with bone. And it's like a little powder bone, okay? There are many different types, synthetic, from a person, so which is like donor bone or synthetic. Or there's ways to also autogenous graft, which is from the same patient. We remove a piece, which is a little more traumatic. But then we put a collagen membrane, we close. And then in 3 months, that graft is going to solidify, because your own body is going to also mesh with it. And then you're going to have a better wall where to put your implant. So you're gonna have a better support. Because when you take a tooth, let's say from the bottom or even from the top, with time, it's going to heal like this. Like a half moon. So it's more difficult to put an implant. And depending on also what side, what place of the mouth, and also if it's on the maxillary area, you have the problem of the sinuses, which I think that's what you have. So you have to be very proactive when you're gonna get a tooth extracted or something planned. Make sure you have a good conversation and your dentist listens to you. I am very big on the treatment planning and answering all the questions from the patients, because I know as clinicians, we know everything about what can be done, but the patient doesn't. Sometimes they say, oh, I need this and that, but it's something different. It's just because they heard it from someone. So I think educating the patient before any choices are made or any treatment, I think it's super important. And I think we lack a lot of that in the whole world, actually. I am licensed in Spain and Portugal. I work there as well. And I hear it from patients all over the world that they're confused, or sometimes they even come to my clinic and, I'm gonna say, how many times gum disease in the USA and I think around the world is the number one disease that is misdiagnosed or not even diagnosed, even by dentists, And it's very important, because if you let it progress, you can lose your teeth. That's another reason that we have created SK Balance, because in between visits to the dentist, you need some form of protection. You need to have the good elements, the good materials to support that. And so we want to avoid the fluoride that's available in the toothpaste out there, in regular toothpaste. And I know it's been there for, since we were born, it was there. But now there are the studies that say it's not good, and it is supported. So the SK Balance doesn't have fluoride, but has the nanohydroxyapatite, and it has aloe vera. Aloe vera, it's an anti-inflammatory, so it's gonna soothe the gums. If you have any more red areas, then this is going to help. Also has vitamin E, because the vitamin E heals the tissues, and your gum, it is a tissue. So it's going to be a 24-hour support for your mouth. So it's going to have those ingredients. Also, it's going to help on your sensitive teeth. It's going to help on the gums, the inflammation, and it's going to protect the enamel like no other. Remember, nanohydroxyapatite, the powerful mineral that's inside this toothpaste, was designed by NASA, so that the astronauts, when they will go to space, they will have a protection on their teeth. If you notice, these two astronauts that they were stuck in space for 9 months, their problem, first of all, they didn't know they were going to be stuck there for 9 months. But their huge problem now is that their bone mass has decreased so much that they have high risk of osteoporosis, and their muscle mass decreased. So this nanohydroxyapatite was made to protect the teeth of the astronauts. So imagine if they would have thought to protect the bones as well of their bodies. It would have made such a difference. So let's think, guys. Oh, sorry, you wrote, I didn't see it. It was tooth behind the canine. No tree. Oh, that's the tooth that's super visible. Yeah. I mean, if you cannot get an implant, you don't want to go through a lot of extensive treatment, you can always get a bridge, which is 3 crowns together. Obviously, the drawback with that is that if the 2 teeth adjacent to the space are, healthy, you'll be cutting those. You also have another alternative that it's a removable partial. Now there are partials, you can check on the videos that I post. There are a lot of partials we do without any metal. That's not gonna harm your other teeth. But I'm sure, your doctor has to give you the alternatives. I always, as a treatment plan, no matter what, I always give all the alternatives. That it's like a menu of things that the person can choose. And even one of the alternatives I actually give to the patients is no treatment. Like if you take out a tooth and you don't do anything, but I explain all the problems that it can arise. So I'm gonna do some videos explaining each scenarios or options you have for treatment, because at least if your doctor doesn't tell them, at least you go informed. So if you have any questions about your treatment, I'll happily talk about them and give you some suggestions or options, and then you can go and show them to your doctor so that you can get them done in your country or in your city or wherever you are. Because I love talking about teeth and health and all that. I mean, after all, it's what I chose as a passion that I like. So yeah. So if you have any questions or wherever you are, I'm gladly answer. Remember, so these are for brushing your teeth. Oh, did I say anybody can use them? There are no contraindications, like if you are under 6, kids, adults, anybody can use it because it doesn't have any harmful or harsh ingredients. So I want to thank all of you that have been watching. Thank you so much. I will continue making videos, and yeah, I kind of lost track even what day it is today. But yes, let me know if you have any questions. Send me a message. If you can't, if you don't have the TikTok shop option, I'll let you know how to get these 2 products, amazing products. So created by dentists. So they're gonna, a lot of them hated by dentists because it's the idea is to make us out of too much work, so that you don't spend, remember, spend on prevention rather than on actual problems, because not only they're expensive, dental treatments, I think in the whole world dental treatment is not cheap. So you want to prevent any problems arising, and I can guarantee you that by using the SK Balance toothpaste, your teeth are going to be protected, your gums are going to be protected, and your whole body is going to be protected. So you can get it here on the TikTok shop. It's the most premium toothpaste. Once you start using this, you're never going to go back to regular bad toothpaste. And it's dentist created and recommended. And also, not only thinking of your health, your body, your teeth, your smile, your mouth, but also the environment, the planet, okay? Because the tube is not made of plastic, it's plant-based, so it's not going to deposit any microplastics into the toothpaste. Because yes, regular toothpaste with those plastic tubes that usually are made in weird places, they release microplastics that go into the toothpaste because it's sitting there, and then when you brush, you start absorbing them in your bloodstream, and that stays in your body forever. So you're not gonna get those microplastics from this. So I thank you so much for watching me, spending however minutes you have, or seconds, or any time, or with me. I lost track of time, and because I always like to talk a lot. I think that's one of my sometimes not so good things. I don't know, at work, because I start talking with every patient. I kind of know my patients, like I know everything about them, not just whatever happens in their mouth, because I talk. And even patients, sometimes when I pick up the phone and I help to, when everything is very hectic and I sit down to write notes and the phone rings, I pick it up to schedule. Even people that I haven't even been there, just to schedule, I start talking, and because I like it. So thank you so much for watching, and have a blessed rest of the day. And I will continue doing. Oh, thank you, Samantha. Oh my God, Samantha in Dubai has been with. Oh my God, and it's so late in there. So thank you so much. Eid Mubarak to all of you that are celebrating, and thank you so much. Have a blessed rest of the day or evening wherever you are. And whatever questions, just send me a message and I will respond. And I will continue and try to do more lives because I know you guys asked for it. And if you have any questions about the products, you just let me know. So thank you so much. And remember, brush, floss, and take care of your smile.